diabetes. So let's say for Ghazi or myself, as we're not diabetics, alhamdulillah, when let's say it's not normal for us every day, but maybe I will bring for him a big piece of chocolate cake or brownie or something, and he's going to eat this whole big portion of a chocolate cake or a big size of a cookie, which is not something that he does every day. And after that, if he goes and makes his blood sugar test, is it going to be still a right reading?
No.
No, because his sugar is going to show a lot, right?
Yeah.
After having consumed that big piece of a chocolate cake,
yes.
even if he is a non-diabetic. So how is it that we can avoid this?
This is the important is HbA1c. This is the important one, because at the time when patient taking food like that, maybe sometimes some insulin is secreted more during after eating.
Yeah.
So maybe we find blood sugar after 3 hours, 4 hours is good, but this does not mean that the patient don't have diabetes. He have diabetes. So HbA1c is good.
Yes.
Way.
And when you do hemoglobin A1c, you don't need to be going fasting. You can just go after having a meal or
no, anytime.
Yes. And Dr. Sami, let me ask you about what are some of the common mistakes that people are doing nowadays? Those with diabetes, sometimes they would be taken to the hospital because of the wrong control for diabetes. What are some of those bad practices that they are?
The bad practice we can talking about type 1, the most dangerous mistake if he has taken insulin and didn't take food after that. This is very dangerous because if he take insulin and no food, so blood sugar become very low and maybe patient die. So we instruct patient with type 1 must be prepared food before he inject the insulin. If no food, don't inject insulin, because sometimes he take insulin, then calling phone, go like this, forget to take to eat, 1 hour, 2 hours, blood sugars become low, patient may be die.
Wow.
It's very dangerous for type 1. For type 2, some patient thinking that if he eat everything, then he walk, blood sugar become increase. Exercise is good for diabetic patient, but not a patient is eating everything, then he is running or walking for half an hour. Okay, I am eating, then running, no problem. This bad mistake also.
So what should people with type 2 diabetes do? How is it that they can have good management?
This must be follow-up. We have follow-up for diabetes in 2 ways. There is short-term follow-up and long-term follow-up. Most patient is following to his doctor, education, examination. He must check his eye, fundus examination every 1 year. He must check for kidney, he must check for lipid, must check this everything. So this late complication. And there must be education also. Education is important, but nobody aware about education. Education diabetes. The diabetic patient go to the doctor, just write medicine and go. This no. Must be patient educated well, so he can prevent complication and take a.
So you said that a lipid test, kidney function test,
yes,
and an eye examination, which should be every year.
Yes, it's normal every year. If not normal, we must follow.
Eye examination for that.
Yes, because diabetes affect, as we have said before, all the body, including the eye. There is the problem for the retina, and maybe patient lose the vision if you don't control diabetic retinopathy, diabetic nephropathy. All the diabetes don't leave any organ without damage. If you are not aware, you will everything is lost.
How many years of having diabetes should you start doing a kidney function and an eye test?
Even in the first day, because maybe patient have diabetes but he don't know. So in the first day he must check. First day he is discovered this patient is diabetic, he must discover everything. So maybe he have diabetes but since 1 year, but maybe he don't know. He have go urine most time, but maybe he thinks this is normal for like that. So,
but are these symptoms for everyone, Dr. Sami? As you mentioned in the beginning, diabetes type 2, because type 1, most of the people are born with it. It's from a very early stage in life, so you know about type 1 diabetes. But when it comes to type 2 diabetes, because it happens in the later years of life, sometimes you may not know about it. Now, most of the doctors who come here, talk to us in the program, would say that type 2 diabetes, how you can identify it by persistent weight loss and as well as frequent urination and persistent thirst as well. These are the 3 symptoms through which you can quickly diagnose or identify diabetes. Now, when we talk about it, are these 3 symptoms the most common symptoms seen among most of the patients or no?
Some patients coming with complication.
Oh.
We discovered sometimes the dentist or ophthalmologist is the one discovered that patient had diabetes, not internal medicine. Sometimes patient go to the ophthalmologist and check his eye, he finds some problem with the retina. Also dentist, sometimes would check, he suspects this diabetes. Not all patients this normal symptom, but there is some patient coming with complication. Even type 1, patient may be discovered with coma, first time. Patient coming with coma, check sugar, he is diabetes, he don't know. This find in young age, 5 years, 10 years, we find some of them coming with coma. This first presentation for us to know this have diabetes. So,
yeah, and Dr. Sami, let me ask about the injuries. If someone is injured, let's assume 2 people are injured, the same injury, one with diabetes and one without. Are they treated the same? Is it worse for the diabetic?
Worse for diabetic, sure, because diabetic patients have blood supply not good as normal patient. We have many, we see thousands of patients have amputated leg. Patient may be loose, his one of lower limb, sometimes both lower limb because of diabetes. He has a small wound and he ignores this wound. He didn't go to the doctor, he put some dressing like this, and the patient of diabetes have sensation not like a normal one, so no sensation. Maybe he injured his foot, he didn't see. Just he see big wound maybe after 1 month. So there is food care is very important for diabetes.
So there might be a stage in life where they would cut a part of human being because of diabetes,
because of
not
diabetes.
paying attention.
Which
if
is
a small injury, even a small injury.
This is uncontrolled diabetes,
Yes.
right? We don't want to scare everyone.
Yeah,
So it's
uncontrolled.
No,
diabetes.
uncontrolled, and
Yeah.
we are for education, as we said, education is important because there is must be patient educated how to examine his food. We are, alhamdulillah, we are here in Muslims. We are praying 5 times. So every time he wash his food, he must give a look for his food. Because if he has small scratch, by time become big, he didn't feel. Then go to the doctor at the late time because blood supply is not good for this limb. Maybe go in gangrene, as we said. I don't know if gangrene is, everyone is know. And then maybe he loses his lower limb. Yes, gargarina, yes.
That's right. And Dr. Sami, as we're talking about care for the people with diabetes, and we are constantly emphasizing that uncontrolled diabetes especially could lead to many problems that everybody needs to be careful. For people who are really wishing to have the accurate blood sugar reading, they can go and do hemoglobin A1C, which you said is one of the most reliable tests, which will give you reading for 3 months. And for lots of the people who are checking their blood sugar levels at home for type 2 diabetes, you should do it after 8 hours of fasting. And when you do a random check, because lots of the people with diabetes do one check which is fasting and the other which is after food. How much should we wait after having our meal in order to do a test of random blood sugar?
Just 2 hours.
After 2 hours of eating the food that you should go and
we
do
call
that.
this postprandial blood sugar.
So this would be giving you the most approximate reading after 8 hours of fasting of what your blood sugar is like, and as well as which is 2 hours after finishing your meal. Now, should we consider what it is that we are eating, because maybe one of the days, so we have to do it more than once to know a good idea.
Exactly, yes.
Because maybe one day you have finished eating your kapsa and after 2 hours you're doing it, and maybe one day you're eating brown bread or something and then you're doing it. So of course naturally that day it is going to come a little less after food in comparison to the day that you had a big plate of kapsa rice.
Yeah.
Kapsa wouldn't affect
Kapsa is the problem in Saudi.
No, it is, Ghazi, because carbs, high carbohydrates affect
Yes, yeah.
diabetes.
Kapsa and fast food, all these dangerous.
But is the food maybe, and the traditional foods that we're having, is the main cause maybe for diabetes?
Yes.
Especially in GCC, in Egypt as well. We know that the...
Same, we have bread, we have rice. So there's 2 carbohydrates. We have more bread, we have more rice, end result is carbohydrate.
Are you familiar with maybe some of the statistics about the percentage of people who are having
in
diabetes?
Saudi, last
Saudi,
around
Egypt, and GCC.
Saudi about 18% 18% of Saudi population have diabetes. This is high, very high. Saudi is one of the maybe 10 countries have very high diabetes. Also Egypt or Arab world, because we have even outside foreign bardo for fasting food. We have the problem with our food. They have the problem
Same
with
the
fast
states
food.
and the West as
The
well.
state also have long because obesity also. Diet control is very good for diabetes patient, weight loss, because overweight suspected to be have more. If you have family history, he will get diabetes.
Yeah, and
So losing weight is important.
is it so common to have a new baby who was just born with diabetes?
No, for me, I didn't see
It's not very common. Like already
the
having...
youngest one I see in my experience, maybe 3 years.
3 years.
I didn't see less than. Maybe it's there, but for me, I didn't see.
Because maybe some people are born with failure in pancreas.
Yes.
might
Pancreas not working. This problem for you cannot tell the baby don't eat chocolate, don't eat sweet.
True.
Like this, very difficult. For the big, we have facing difficult to prevent this one. What about the younger one? 5 years, 10 years. You tell him no Pepsi, no chocolate, no everything.
No way, yeah.
It's difficult. Yeah. So they try to make this insulin pump and other method, and under trial also to make transplantation of islet cell of pancreas that secrete insulin. But this all under trial until now. No.
In the future, you think?
In the future, we hope.
There would be maybe something that would be installed in pancreas, so people would be treated.
Yes, they try. They try with insulin, but oral insulin is failed. Until now, they cannot, because injection, most of diabetic patients don't like injection.
Yeah.
Young and old, even one old, he tell no, I don't like injection, because he thinks that once he take injection, he will all the time with injection. This also wrong idea. If patient is not controlled, we can give insulin for some times until he lose weight, until he control diet. Then he can stop injection.
Indeed. And with this, Dr. Sami, let me ask you about some of the foods that are bad for people with type 2 diabetes, as we concentrate on more, because we have a larger number of our population affected with type 2 diabetes. So when we talk about it now in Saudi Arabia and in GCC countries in general, there are food practices. So fast food is not natural to us, but the traditional foods which are natural to us, people are not willing to give them up, such as, for instance, with every cup of coffee that you are going to be drinking, be it the traditional qahwa or sometimes even other coffees, you would have something sweet to go with it, but especially for the Arabic traditional qahwa, you're always having dates with it.
Yes.
And dates is a food of the region, of the country. Religiously as well, we see the significance of dates. So this is one of the most difficult foods to tell people not to be consuming. Tell us about diabetes and dates.
It's a problem, because one date, one date, maybe you have more than 25 calories. It's very high. If you are taking 10 pieces, 250 calories. And this only date. What about drink? What about food? What about other? So, and also about carbohydrate, rice and bread, also better. I advise also always my patient, I tell him, when you start main food, better if you start with salad. Salad is a good one, and take space of the stomach. If he takes salad, next one is to eat protein. After that, he cannot eat rice too much. But if you start with rice, we cannot stop. If one.
How much of rice should a person with diabetes consume?
We take about 4 to 6 spoons, big spoon.
4 to 6 big spoons, not tablespoon for eating, but a little bigger than that.
No.
4 to 6 spoons.
Yeah,
so
this is the maximum.
This is the maximum. So maybe if you're talking about tablespoons, then 10 to 12 tablespoons, which are going to be heaped tablespoons, should be able to suffice.
Yeah.
And what about dates? Let's say if you're having a cup of coffee as a diabetic person, how many dates can you have to go with it without having?
In all the day, maximum 3.
Maximum 3?
3
in the day. But that means not 3 immediately together at the same time?
No.
Yeah, so for diabetics who have especially type 2 diabetes, it's good to divide your meals and have multiple small meals instead of having one big meal or two big meals, so that it's going to be a slow process for your body to be digesting all the food, and that means that all the sugar secretion in your body is going to be slow in small doses, and your body would be able to take that easily. And also honey is one of the things that I would like you to tell us about.
Honey is a problem. Honey, we have either that honey is good in the Quran, honey is good, but sometimes it's not pure honey. This is the problem.
Fake honey.
Fake honey. This is the problem. And we can check also if the patient like to know this pure honey or fake honey, just he check his sugar before taking honey and check sugar after 2 hours. If very high, this means not pure honey.
Oh, okay. So, well, we would just advise all the people with diabetes to be careful of the sources of honey that they are getting, and that if it's the purest source of honey, it's not going to be harming your body, but if it's artificial kind of honey, it's going to have a harmful
because it's mixed with sugar. As
yes,
they make it.
With sugar.
It's really sad.
They just
really
want to sell more, and this is the problem.
But, you know, also I think people should understand, Dr. Sami, that let's say, you know, if you're getting a big amount of honey for a small price, then you should be able to understand, because honey, it's a natural procedure with it, it's made, and it's not how the cows are giving milk the same way the bees are giving honey. It takes a lot of the bees to give a small supply of honey, so honey is supposed to be expensive naturally as well, even in areas like Taif or Asir, where there are lots of flowers, lots of bees and lots of honey, but nonetheless it is produced in small quantities, even if it is big for that region to be producing that much. So honey is supposed to be expensive. If you're going to be buying honey and paying a small price for it, that means that most likely it is not going to be all natural honey.
And we check his sugar before and after. He will know if we have. Sometimes patient come, I bring honey, it's very expensive. But if he check after 2 hours, sugar is become more than 200, this is not good high.
Yeah, and finally, let me ask you, Dr. Sami, about, you mentioned it's maybe 18% of people who are having diabetes. How can we prevent this number? Maybe how, through educating people about the food?
Yes, about educating, like your program here. So we have sent some message for the patient to know, and also weight loss. The overweight is a problem here also because of the traditional diet. So we get more weight. So patient must be, even he don't have diabetes now, but he must keep his ideal weight. This is important, and change traditional habit or traditional diet. Try to become good.
Indeed. And with this, Dr. Sami Mahmood would like to thank you so much for joining us in today's edition of the program. And well, the conclusion for the day today is that for all the people who have diabetes running in their family, try to go and do hemoglobin A1C test. It is a very easy, simple test that you can do at any time of the day and would give you appropriate and approximate blood sugar readings for the past 3 months. That means you would have a very good idea of how regulated your blood sugar levels are. And we hope, inshallah, everybody a very good, very fit and a very healthy life as well. We all need to do lifestyle management and lifestyle modification with the diabetes or without diabetes, because we need to be thinking about a better life and a better future. For the moment, let's see the future of some of the economic updates as they are going to be coming to us through the Saudi Morning Show up next. Stay tuned.